what's happening is, yes, that when you look in the mirror, it looks like it's gone. And technically, in the mirror, it has gone. But under the skin, it's still there.
Qualitative studies, everybody says once you've done it once, that's it, you can't stop. You just have to go back for more.
And so you do it again and then, oh, I've got that punch again. I've got that, whoa, look at that wow factor.
Especially at the start, it was really good. And I was like, oh, I finally have cheekbones.
It comes back. And then another 2 years. And if you don't look at your old photos, you're gonna have this layer of almost diffuse mud. It's like mud, isn't it? It's just like just sitting in the base, and you keep building on top of it, and then eventually it's just gonna become a big stack. And then after 4 years of doing it, you don't remember what you looked like 4 years before, and you've got, whoop.
As a practitioner, you deny it because you just think to yourself, gee, no one's told me that fillers can last more than a year or more, and you just deny it, even though you see it right in front of you.
We don't often see how wrong a fashion trend looks until the trend fades. Maybe for this reason, filling has remained in fashion, with research predicting increasing rates of usage.
Can you give us a ballpark figure of how many mils you think you had?
So hard to say. Maybe 40, I don't know. I don't know, maybe it could be more, I don't know, like a lot.
But perhaps we should ask ourselves the question, why is filling not fallen out of fashion? Does filling really make us look better or younger?
45? I get maybe late 20s, 30s. 22, yeah, shocker.
Have we stopped to question why we are filling faces? And I'm not just talking about overfilling. The biggest problems are the ones we don't see, quietly fueling the excessive and inappropriate use of fillers. One of these problems is the belief that fillers only last months. For most of my time injecting, I believed that filler longevity was from 6 to 12 months. Even after 15 years of injecting filler, I didn't have a single patient complain that their filler lasted too long. Until I did in 2019 with an MRI confirming the presence of filler many years after it was injected. In 2020, Dr. Mobin Master published a landmark MRI study in PRS showing filler lasting from 2 to 12 years. On the back of the study, Alice Hart-Davis, a beauty journalist, reported her own filler MRI results with this response from an experienced doctor showing his disbelief at how long fillers can last. Alice also asked filler companies how long they believed their fillers lasted.
You approached each filler company individually and you asked them their standpoint on filler longevity. None of them came back with that it may last for longer than sort of a couple of years.
No, they all just came back saying we have studies that show this is how it lasts and this is how long.
So when was the last time you had filler?
I think it was now at least a year ago, maybe more. It's quite a while, but I'm not planning to get any more, obviously. Yeah, it was quite a while, but I don't feel like it's gone down at all in that time, and they're meant to be like not permanent.
So we had a perfect storm of patients, practitioners, and pharma all believing the longevity of temporary hyaluronic acid fillers to be months rather than years. Surely increased longevity should be a good thing. However, longevity and longevity of effect are not the same.
This was a study on my own face over a period of approximately 33 months where we did sequential MRIs. I had filler, did an MR straight afterwards within 3 days and had a look at it, and you could see this pattern, and you can see that it looks like a fan, a beautiful fan where it goes 1, 2, 3, and it's very neat.
Well defined.
And looks well defined.
Yep.
But does this definition last?
If anything, I feel like maybe it's just gone bigger, maybe like it's absorbing water or something, like it's just bigger, less shape and more just everywhere, like puffy rather than sculpted, you know.
According to Dr. Master's MRI scans, this definition does not last.
After the 2-year period, it kind of didn't have that punch.
Yeah.
But
when you did,
it was still there. But it won't look like it's there anymore as much because it's kind of flattened and diffused between the areas of definition over that time. And it was still there. Good. And the filler from before that was there from the start was all there too. So that's even older, and that was all the way through to 33 months.
So what you saw from that study essentially on your face, that filler lasted a very long time, a lot longer than the 6 to 18 months or so that we expected to last, and it changed over that period of time as well.
It changed.
And you noticed that
sort
clinically.
of the way it sort of, the defined lines kind of became a bit fuzzy, right? But it did not move from fat compartment.
Okay.
So it didn't catch a bus and travel down to here.
It didn't move to the other side of the face.
It stayed in the same spot. It always stayed where it was placed.
Yes.
So where it was is where it stayed.
But less defined, ill-defined.
But ill-defined.
Yeah. Do you think these sort of changes with filler over time, do you believe that this could be misconstrued as filler possibly leaving, going away, maybe, causing the patient or the doctor or the injector to actually want to have another refill? Do you think that, what do you think of the plausibility of that sort of statement?
I think what's happening is, yes, that when you look in the mirror, it looks like it's gone. And technically, in the mirror, it has gone. But under the skin, it's still there.
It's just less defined.
And so you do it again, and then, I've got that punch again. I've got that, whoa, look at that wow factor. It comes back.
Patients often become addicted to the effect fillers provide.
I did some research on addiction to cosmetic injectables. Qualitative studies, everybody says once you've done it once, that's it, you can't stop. You just have to go back for more.
The addiction may lead to filler patients chasing the hit of this initial defined filler look.
Yeah, so at the first it looked good, and then after quite a few months it started to look a bit odd, but I was like, I'll just keep going because I don't want it to go back to how it was before. So I was like, if I keep topping up, it just will stay a lot longer.
And if you don't look at your old photos,
yes,
you're going to have this layer of almost diffuse mud. It's like mud, isn't it? It's just like just sitting in the base, and you keep building on top of it, and then eventually it's just going to become a big stack.
Yeah.
And then after 4 years of doing it, you don't remember what you looked like 4 years before, and you've got, whoo!
But quantitatively, what I did was I looked at a substance use module that we usually use to screen for drug and alcohol addiction, and adapted it to cosmetic injectables. And we found that 19% of people actually would have come up as screening addicted to cosmetic injectables, which was huge.
So that idea of just trying or having a little bit and not wanting any more after that, it might be difficult for a great percentage of people.
Yeah, I think so.
I want to focus on one particular area. On the MRI, there's a T2 fat sat, which you can see up here, which the fat is all blackened out, and all that white stuff that you see, this is an axial image, which is a slice this way across the cheeks. All along the zygoma, the bone here is called the zygoma. Along here, all that white stuff is filler. It's all filler. And her cheeks, technically on the MR, looks like they're all the way out here.
In terms of your perception of your own face, how do you feel about your appearance currently with the fillers?
I think it looks bad. Like if you look on camera too, it looks in weird spots. It doesn't match. So it's sort of like your face is your face, and then the cheeks go outside the face. So it doesn't match. It doesn't look good.
And is that a lot of filler on
that? That is a very large
in comparison
volume.
to other.
That's a large volume. I'm used to seeing maybe 5 mil, 8 mil. This is well and truly above 2 centimeters of thickness. And if you think about it, our bone, we don't have more than a few millimeters of skin on the top of your bone here. The coronal you can see here, this slice, you can see filler all around that area too, but she also has filler in the cheeks as well, and sort of around the nasolabial fat. So there's filler pretty much almost everywhere. So you end up getting this huge alienized face, and then your temples start looking narrower and you get a peanut. So you got to start filling the temples, and then where do you stop?
Yeah, well, it can become a bit of a addiction in a way. How do you feel about now the potential of dissolving this filler and going back? What are your thoughts? What are your feelings around that?
From the beginning, like when I thought about dissolving it, I heard like a lot of people say that it dissolves your natural collagen and stuff. So I'm mostly scared about that about that still, because I'm not like young anymore. Like, yeah, you know, I probably won't produce as much collagen now, so I'm not sure if it's true or not, but I'm just scared about that mostly. Like, obviously I don't like how it looks, so that's not the issue.
I mean, there is a significant fear around dissolving filler, despite the fact that, you know, people may be significantly overfilled. Is there any scientific evidence that we know of to show that filler dissolver actually dissolves anything but filler?
There's no papers or scientific evidence at this stage to prove that there is a permanent tissue destruction or cause for tissue destruction using hyaluronidase.
Unfortunately, whether this is true or not, there is a post-hyaluronidase syndrome where patients believe that their face has been destroyed. And here is a post on realself.com of the first patient I MRI'd, now complaining about her face being saggy after hyaluronidase many years later. I wish I knew then what I know now about fillers, and this story may have been very different. So with all this knowledge in mind, hopefully we can stop the fashionable overuse of fillers. So what can we do to help reduce the fashion of filling? Understand that the filler you put in today may last 10 years or more. Understand that the initial effect from filler is temporary, unlike the filler itself. Understand that filler is addictive, especially the initial effects, and people will chase this with more filler. Understand that prevention is better than a cure. With all this in mind, set yourself strict limits regarding when and why you use filler. Dr. Stephen Harris, a cosmetic doctor from the UK, taught me how this Da Vinci quote related to the overfilled. I know it took me most of my injecting career to see when it came to fillers, and I hope this talk helps you see also.